Welcome to the Dutch testing page. I just wanted to take this opportunity to explain a little bit about what Dutch is and when to use it and when perhaps it's not the best choice for you. So I get lots of questions about Dutch and what Dutch is all about. It stands for dried urine testing for comprehensive hormones, and it's quite different to using blood tests to see where your hormones are at. So with a blood test, you're usually very restricted in terms of which hormones you're testing, and you get one chance, you get one snapshot at looking at the levels, because you can only see what they're doing at the point where you draw the blood. This is not terribly helpful in perimenopause because your hormones are fluctuating wildly and constantly, so you're not really getting an overall picture of what's going on. Dutch testing is quite different because what you're doing is you are looking at your hormones over a period of time. So it might be a week, it might be a month, or even longer. And you can get a much clearer picture of how they're fluctuating and exactly what's going on at each point. The other thing with Dutch is that, I'm not sure if you're aware, but your hormones are made from your other hormones, and Dutch can give you very detailed information about what's going on at each point in those chain reactions and where it might be falling down for you. So in my practice, I don't actually need that level of detail in order to treat you. Herbs were never meant to be that complicated. And I know some herbalists who do sort of work in very minute detail in terms of, which herb interferes with which chemical reaction and so on. At the moment, that's not how I choose to work, and I still get really good results, usually without Dutch and without having to know that level of detail. However, if you are a details person and you want to know exactly what your hormones are up to, by all means, go ahead and get a test done. The only times when I find it particularly useful are things like infertility. It can be very useful for getting some insight into what's going on there. Also, if you have another long-term health condition with perimenopause on top, it can be good at helping you to unpick which symptoms are coming from where. Otherwise, it's entirely up to you. I know some people say, well, I need to know exactly what my hormones are doing. The question is what you're going to do with that information. The other issue with Dutch is that interpreting the reports is quite an art. It's quite a long and complex process, and you need to find someone who really knows what they're doing. So I can do a very basic interpretation, but I am by no means an expert, although I can put you in touch with people who can do that for you if you like. So, even sometimes menopause doctors who've got Dutch blood test results aren't confident in interpreting them, and certainly aren't confident in extrapolating that information into something they can actually use in order to adjust your dosage of HRT, for example. So, it is an investment, and that's fine if that's what you want to go ahead and do, but just be clear on what you're going to do with that information and what use it's going to be to you once you have that test done. So if after that you would like to go ahead and order a Dutch test, the link is on this page, and it just takes you directly through to Regeneris Labs, to the Dutch Plus test page. There are lots of different Dutch tests, and they are a bit of a minefield, but that one seems to work well for most people, and men can use Dutch testing as well. And then if you would like some help with interpretation in the context of your symptoms and what's going on for you in general, please do get in touch. We can book you a power hour where we would do a deep dive into your test results. Or if you just want to ask a few questions, simply book a free call with me, and you'll get half an hour to tell me what it is you need help with. But we can't really use that half an hour to interpret your report, because that's a much bigger job. I hope that's clear. If you've got any questions, get in touch, and I will see you again soon. Bye.